Nurses are here to speak about their advocacy for their patients and the concerns that they've raised.
I'm Kirsten. I'm a UCSF labor and delivery nurse. I've been a nurse at UCSF for 7.5 years. I am the nurse representative on my floor. I'm the co-chair of the Professional Practice Council at Mission Bay. We receive patients from all over the region to provide specialized care at UCSF. And the nurses here are very concerned that those patients that are already going through very difficult times are going to be affected by the building of the Warriors Arena. All the nurses and the staff love the Warriors and support the Warriors, but our priority is our patients, and we want to make sure that our patients have access to the care that we provide at Mission Bay 24 hours a day, 7 days a week. We're concerned that the plan that is currently in place is not sufficient to continue to be able to allow us to provide the care that our patients need.
Sorry, my name is Lily Cooper. I work for UCSF. I work with adult care patients in the transitional care unit. One of the biggest concerns is during a game, obviously, if emergency services are trying to get to our hospitals to get the patients the critical care they need, they might not be able to get through. And, you know, we're big supporters of the Warriors, but, you know, our patients come first, and we have to make patient care safety our priority, you know, in these events. If they can't get the critical treatments that they need, then that's a problem, and we need to discuss the planning for it.
Do either of you have a problem now? I mean, is there a problem now that exists with AT&T?
There already are problems with AT&T, with Giants fans finding parking, with traffic. Those are the big things, parking and traffic.
If you want to move the conversation forward, why not tell people what it is that you think is not sufficient?
Well, 200 parking spots for 18,000 people is not sufficient. The traffic flows that are going to be affected is going to be a problem for our patients. You know, these people come from all over the place. They're not from San Francisco necessarily. So it's already overwhelming for them to get here. And then you add in all those things, it makes it even harder for people who are already going through really stressful times. No, we're nurses. We are part of California Nurses Association. That's
So
our
your
affiliation.
membership vote on this? Is this
No, but I would say that the vast majority of people that work in this hospital have the same concerns that we're voicing right now.
There's a pushback saying that there are 17 other cities in the nation that have a hospital and an arena within a mile of each other.
But not right across the street. Within a mile. Within a mile isn't right across the street.
Elaborate. The main thing for you is the parking and the traffic, and what, are you worried about blocked ambulances, or what are your concerns?
Yeah, I mean, just the traffic flow, the parking, patients, having a more difficult time getting here, especially when there's, 18,000 fans trying to get in or out of the arena.
What's going on right now in terms of Giants fans?
With Giants fans, it's a similar issue already. Traffic, depending on what time of day it lets out, it can be very challenging to get where you need to go. I have a coworker who a Giants game let out the other day, and she left at that time. It took her 2.5 hours to get to the outer Richmond. We have long days. We work 12-hour shifts, and having it extended another 2.5 hours because of traffic, that's a patient safety issue. If you have to be back the next day and it takes you 2.5 hours to get home, then you're going to be you're going to be more tired having to fight traffic the whole way home.
I can't speak for who's against it, who's for it, but there's always a discussion. We have patients that come from out of the country. We have patients that come from Southern California, Colorado, all around to receive their care here. If they need to come here, then we gotta make sure that they get here in a timely manner and receive the care that they need.
I'm Brenda Mendoza. The patient advocacy, we are speaking as patient advocates for our patients, and also we always put patient safety first.
Days where that's a lot of traffic as it is, and there's apparently going to be days where there's both stadiums are going to be open and running at the same time.
Correct.
What's the worst? What are you really worried about with this new stadium?
Well, again, such as Lily and the other nurses before me have already stated that if there's an emergency situation with someone who brings in their loved one into the hospital, whether it be a child or an elderly person, that person's going to need care immediately, and it's going to be whether they can get here in a timely manner with the traffic, and anything that might impact them from getting here can be a life or death situation.